Welcome back, you guys. All right, the dreaded pap smear. All of you ladies out there know what I'm talking about. There's a lot we need to know about the pap smear, though, and we have Lupe Cruz from the LDS Hospital who is here to inform us about pap smears. First of all, why do we need to get a pap smear?
What we're doing with the pap smear is it's a screening for cervical cancer. We look at the cells. We also look for HPV, which is human papillomavirus, and that's what causes cervical cancer. So
okay, so what percentage of women actually have their results come back positive?
Well, you know, it's hard to say a percentage, but when you get a positive result, it actually means that we've seen abnormal cells. Not that we're saying you have cervical cancer necessarily. It just means that you need more screening, that you need more done, so that we can look at what it is that you do have. So.
Okay, so when you're at the actual process of getting a pap smear, that really is what the purpose of the pap smear is just to check for cervical cancer?
Yes, it's a screening. Early detection is what we're trying to do.
Okay, so this is what I didn't realize is I thought that you guys were testing for a lot more things. How funny is it that I have no idea what's going on with my body? Like, I have no idea what's going on. So that's really the only thing you're doing. You're not testing for STDs. You're not testing for any other.
We can. You have to be part of it. Right. It can be part of it.
Okay, got it. So tell me, can you go into more detail about what the HPV virus is?
So it's human papillomavirus, and it is responsible for genital warts, and it can also lead to cervical cancer. So it causes abnormalities in the cervical tissue. So it's just right at the cervix, we do a swab or we take those cells right at the surface and we send them to the lab, and that's what they look for. It can take care of itself. So if it comes back that you have a positive pap smear or you have HPV, depending on what you have, you may need to have another pap done 6 months, a year. Typically, when they're normal, we do them every 3 years, just for screening.
Okay, so hypothetically speaking, it comes back positive. You go back in and get another screening done, and it's positive again. Worst case scenario, what can happen?
Well, there's several steps to it. We do what's called a colposcopy, and this is, again, depending on. There are so many levels of severity.
Okay.
So is it abnormal? Is it HPV? And we have these little acronyms that we go by and some guidelines that we also go by. And so your doctor knows how often you're going to need to be checked, whether you need to have another test called a colposcopy, where we look through a special microscope at the cervix to see if we need to do a biopsy.
Yeah.
Then we do a biopsy, send that off, and see what that comes back as. There are treatment options available if you do have precancerous cells, or if it's abnormal to the point where we need to, take a little more off.
Got it. Okay, so if I were to go in, get my pap smear, it comes back positive, it doesn't necessarily mean that I have cervical cancer. It means I need to get checked. So it's not anything we need to freak out over.
Exactly.
It just means you need to go in for more.
You need to have more testing done, and then following up with what your doctor recommends, so that it can be caught early, so that the treatment options that are available, can be offered to you, and you can decide at that point with your doctor what will need to be done.
Good information, and just a great reminder of why it's so important to get that done. Lupe, thank you for being here. And if you guys want more information, go to ldshospital.org, and you can find more information. And you're going to want to stay tuned, because we are going to be talking